Welcome back to Winning Isn't Easy. Why you should tell your ERISA disability carrier about the side effects of medication when you apply for your benefits. Now, when you apply for your ERISA disability benefits, the disability carrier plan is going to be reviewing your medical records, and they're going to be determining your functional capabilities and whether, depending on the definition of the disability, you're able to perform your own or any other occupation. Now, hopefully your doctor has addressed your physical restrictions and limitations in your medical records and completed the carrier or the plan's attending physician statement forms. Now, if you've looked closely at these APS forms, you can see they don't ask the right questions about your physical functioning, and they don't always ask questions about the side effects of any medication that you might be taking as a result of your disabling medical condition. The side effects of medication can impact your functionality, and some of it might cause significant work restrictions and limitations and prevent you from doing your work or any other work. You should be telling your doctor about these side effects so that your doctor can change your medication and try other types or combinations of medications. And if you don't tell your doctor about these side effects, the disability carrier plan may not later accept your argument that your claim shouldn't have been denied or your claim shouldn't have been terminated because of the side effects of medication. If it isn't there and you're now claiming you're having these problems, the disability carrier is going to go, too bad, so sad. So it's really important that you are documenting with your physician the side effects of medication and that there is a documentation of a trial of different types of medication. You want to make sure that your doctor is noting that in any attending physician statement forms. But just as important, you are going to be asked to complete on a regular basis various forms about your activities of daily living. And you need to document the problems that you're having on those forms with side effects of medication. And you want to talk about that in terms of your symptoms, the medication, how the medication is changing your symptoms, yes or no, and how the side effects of medication, if there are any, are impacting your symptoms and your functionality. So it might be, for example, that you're being prescribed gabapentin. Well, one of the known side effects of gabapentin is its sedating impact. It makes you sleepy. So you take the gabapentin, helps reduce your pain, maybe improves your functionality so that you can stand at the kitchen sink for 20 minutes and sit for 30 or 40 minutes, but it knocks you out, and you're out with a nap because you're foggy and you're tired and you're out for an hour or two. That's important because any of that will impact your functionality. So you need to make sure, again, that it's documented. You might have a medication that requires you to go to the bathroom frequently. That's embarrassing. I know that. But it's important that that's developed in terms of your medical records and the forms you're filling out. I mean, if you've got to use the restroom, if you have to be close to the restroom, that's a problem. If you're, taking these unscheduled breaks and they're lasting 5 or 10 minutes, all of that is going to impact your ability to perform your own or any occupation. You won't be able to meet the pace and production requirements. And that, again, is important for you to document in your medical records and in your forms, because the disability carrier should be taking those side effects of medication into consideration in deciding your claim and deciding to keep you on diary. Now, again, remember, under the ERISA policy or plan, you have an obligation to get medical treatment that's reasonable and appropriate, even if you're having side effects. These tips that I'm giving you will help document those medication side effects, your multiple attempts at addressing those side effects, and your compliance with your obligation to get medical care. Hopefully, these tips will be helpful and they'll make the difference in getting and keeping your disability benefits. Let's take a break.